Hello, Dr. Pelto here. I want to talk a little bit today about how to treat plantar fasciitis at home or with the doctor in the office. One of the main questions that I ask my patients, or some of them, are how long have you had your symptoms? Because I find that the longer that you've had your symptoms, the longer it can take to get rid of it. And then what are the treatments that you've tried? We're going to go through all the treatments, but it's good that you can even try some of these treatments before you go see a professional. And then how does this affect your life? Is it something that's really affecting you, causing you to hobble out of bed in the morning, or is it something that really isn't that painful? So what I want to go over really is what you have, why you have it, and how to treat it. Okay, so let's start looking at plantar fasciitis. This is the way I like to explain plantar fasciitis. Basically, the plantar fascia is this ligament you can see here on the bottom of the foot. Now, this ligament is a secondary support structure. Basically, it's not supposed to support your foot. What supports your foot are the bones, which are right here, and then also the muscles that insert into the bottom of the foot. So if the bones aren't working, meaning if you have a flatter foot, or if there's a collapse in your bone somewhere, or there's some other problem in the bone, that can aggravate it. Now, it's not always a heel spur. Heel spurs usually aren't a problem. Occasionally they are, but not all that much. And then also in the back of the calf, if there is tightness. Now, most people don't complain of tightness or lack of range of motion, but for the majority of patients, that's a big problem. We're going to focus a lot on that. So basically, you can see here, it fans out the plantar fascia, and this is the area that we are going to be working and explaining. What I want to show you specifically here is you can see how the Achilles tendon pulls up and the plantar fascia pulls forward. So both of these are playing tug of war on the bottom of the heel. So let's go a little bit more into it. The diagnostic exam that I think is most beneficial is a diagnostic ultrasound. And what you can see on this picture here on the left is a normal thickness of the fascia, and here is a thickened fascia. And what's good is that when you're being treated, you can look at this kind of before treatment and then at the end of the treatment, and the thickness should come down. Another thing that we get is an x-ray. This shows a spur, but an x-ray doesn't really provide us that much information. It provides us information to show how collapsed the foot is or if there is a spur, but usually the problem more so is with the fascia itself. Well, what are the treatment options? Well, you can ignore and hope it goes away. That's why most people are watching this video, or you're seeing someone in the office. You can do conservative or non-surgical treatment, or you can do surgical treatment. And everyone always asks me this question, well, how long does it take to get better? Just kind of the rule of thumb I say is if you had it for over 3 months, it's probably going to take about 3 months. If you've had it under 3 months, then usually about a month to get better. In the process, I'm always kind of simplifying and making this process better. That's what I think anyway. You want to reduce the pain and control the load. That's number one. You want to repair the injured tissue and not just kind of treat it with an anti-inflammatory or cortisone, and then you want to restore proper function. Now, let's kind of look at, this is the main checklist that we're going to go through. So if you stick around, we're going to go through all of these kind of treatment modalities, including imaging, traditional treatments, and then some of the advanced treatments. So you don't have to be overwhelmed, but this is the checklist that I recommend if you're going to go see your doctor. You can kind of go see, well, what are they using for the treatment? So let's kind of get into this, and we're going to kind of divide it up by what you can do at home before you see a doctor, and then what are kind of doctor-specific treatments. So first of all, we're going to look at what are the home treatments you can do for plantar fasciitis, like what you can do or what you should be doing before you see someone. A lot of patients ask me, well, before I see you in the office, what can I try first? You can try anti-inflammatories. Now, one thing you have to be aware of, a lot of people that take like Tylenol, they take aspirin, they take an anti-inflammatory. Once again, you have to check with your doctor. But to get rid of pain, you can take it now and then. But really to reduce inflammation, you need to have enough anti-inflammatory in your system for a longer period of time. And the premise I go on is usually 600 to 800 milligrams of ibuprofen 3 times a day. Once again, if your stomach can handle it, if you can handle it, or 2 Aleve or naproxen. You do that twice a day. I prefer naproxen only because it's twice a day dosing, and it feels like everyone forgets that dose of the Motrin. And you do that 2 weeks. I don't do more than 2 weeks. And if it's going to reduce the inflammation in there and make you feel better, 2 weeks is going to help. Okay, that's a way of doing it. You can also ice the area. Most people take this bottle of water you can see down here, and you can roll it on there. Here is another kind of a way of putting a Dixie cup or a cup with ice, or there's contrast baths. Basically, you do a bucket of ice water and a bucket of hot water. You go 5 minutes in the ice, 5 minutes in the hot, and 5 minutes in the ice. You always end in the ice water. And here's kind of a unique example of stretching while you're in the ice water. So that can be helpful. I recommend doing, once again, going back here, doing the anti-inflammatories for 2 weeks, twice to 3 times a day, icing twice a day for 10 minutes. And then the next aspect we're going to talk about is how to reduce the tightness. There's a lot of different modalities. We're going to talk about home treatments, what you can do. Now, everyone talks about stretching. You can watch a number of videos on stretching. I don't find it's all that effective. The one that I like the most, if you're able to do it, is where you're on a stair and you drop your heel down. But for most of my patients, I actually find soft tissue massage works the best. So you can use any number of tools. There's like this ball tool with a yoga block. There's a foam roller, which is the most versatile, and there's a stick, and there's like a balls like these. There's different ways of doing this. And at the end here, you can kind of look at what ones I recommend for you. There's different things, but 10 minutes twice a day, and it should hurt when you're doing it. Okay, that's the key, and that's going to help with range of motion. You have to evaluate how tight is your calf. Basically, you want your calf to be able to get at 90 degrees. If it can't get at 90 degrees, then there's kind of a problem there. Other things that you can try before you see a doctor, you can try a towel stretch before you get out of bed in the morning. You can try a Strasbourg sock. That's what this is called. You can try a night splint. People tend to buy these before they come in. Be careful, though, because some of these things your insurance covers. For example, if you see a doctor, they could just as easily prescribe you a night splint, so you wouldn't have to buy that. Other ways to reduce kind of stress and strain on the foot before you see the doctor, trying new shoes with more support, trying to do an over-the-counter insert. This is the one I recommend on Amazon. It's called a Walking Hero or Walk Hero. It's one of the best I found. The main thing you want to look at with an orthotic is that when you push down the arch with your finger, it shouldn't collapse. If it collapses, it's not doing anything. And then you can also do some taping of the foot. There's different videos that I'll kind of link to here. So if you want to do taping, there's some taping ideas. Okay, so those are things you can try. Now, how much time should you give it? I basically recommend giving it, 4 to 6 weeks. And if after 4 to 6 weeks you're not getting better, you should see a doctor. And these are kind of the specific treatments that I would see. Usually, when I see someone, if they've tried all these other things, then I'll start with these next treatments. If you haven't tried those, we may start with those other things first. Okay, so my main go-to these days is going to be Shockwave Therapy. And basically what shockwave is this little piece of metal that bumps back and forth, and it creates radial shock waves. And we apply that to the area of the plantar fascia and the area up the back of your calf. And I do this if your pain level is a 5 to an 8. If your pain level is a 10, I might still do a cortisone if you're limping around. But for most of my patients, we're doing this shockwave. Now, I don't want to overwhelm people with the science behind it, but there are 2 types of shockwave machines. We have both of them. One is a radial and one is a focused. And what does it do? It basically stimulates circulation. Once again, if you remember what that fascia looks like on the picture, it was white, and there's not really good blood flow to it. So by doing this, it stimulates the blood flow. Also, it helps with metabolism, specifically nitrous oxide and vasodilation, opening up the blood vessels. There's also some of these big words here. I'm not even going to go through because they're a little complex, but there's some anti-inflammatory effects and growth factor effects, and stimulating your own types of stem cell, your own type of cell proliferation. Basically, the easy way to think about it is I'm taking something that's chronically inflamed and I'm injuring it to make it more acute. And that way your body heals itself. Okay. Another thing that we use in the office, if you've tried the over-the-counter inserts, or if you're really, really flat, doing a custom insole and the custom orthotic. The reason we do this is to help realign the heel position. We do it for posture. It's used to help relieve high pressure areas, reduce internal tissue stresses, and then reduce any excessive or abnormal motion in the foot. You can see kind of an example of an orthotic. Another thing that we don't do, but we send people for, would be physical therapy. This is a specific technique called the Graston technique to loosen the back of the calf, helps reduce the tightness, evaluating any core imbalances, and helps with training and recovery. A lot of times you have to realize that the problem isn't your foot, it's how your body moves over the foot. So that might be the calf, that might be your core, and other types of instability can really cause this. And then temporarily we use these types of things. I don't use these that much, but you could use like a compression sock. Here's like a 3/4 compression sock. There is something called a velocity brace. Once again, I'll put a little link that you can see these. What's a velocity brace? Well, it's an ankle foot orthotic, so it's not just an orthotic. It goes up the ankle, and it allows your foot to go up and down. It doesn't allow it to go side to side. It's the side to side motion that aggravates the plantar fascia. And then if someone's in a lot of pain, or if I'm doing an injection, I may put them into a walking boot. Okay. And then we get into there's different types of injections. Okay. We don't do as many cortisone injections anymore in the office. Occasionally, if your pain is really high or if nothing else is really working, we'll do an injection. We tend to start with Shockwave these days, but there are different types of injections. Specifically, one's called a platelet-rich plasma injection and another one's an amnio injection. And both of these are used to help restore the normal function of your foot and promote your body to heal itself. And you can kind of see an example. Black usually on an ultrasound is bad, and then if it repairs, it turns more white. And this is an example pre and post ultrasound of an injection into an area that's injured. Okay, don't be scared. They're not that painful, even the cortisone injections. But we tend not to do as many cortisone because it just reduces inflammation. It doesn't really repair things. And then finally, there are some advanced treatments. We've talked about some of them during the course here: Shockwave, amnio, PRP, and everything we do is to try to avoid surgery. However, surgery sometimes is necessary. So let's kind of look back at this checklist once again. And we reviewed everything here today: the imaging, which is with an X-ray or ultrasound, and potentially even an MRI. If you're considering surgery, we might get an MRI to help repair and heal it. Once again, Shockwave, amnio, or PRP. Reducing the pain, a cortisone injection. I recommend resting it, possibly even in a walking boot. Anti-inflammatories, icing. And then reducing the tightness with physical therapy, home therapy that we talked about, stretching, night splint, and then reducing the stress and strain with the supportive shoes, custom orthotics, ankle-foot orthotic walking boot, and then some of the advanced treatments. So I hope you guys find that helpful explaining. This is what I give to my patients. I'll put some resources here at the end. I hope you enjoyed this. Thanks. Hey guys, thank you for watching Healthy Living. You're going to find a few links here I'd like you to click. One is to subscribe to this channel on YouTube. Also, you can learn more. There are some videos here you can see.